be lovely if you could tell us a little bit.
So just quick background, I've been in healthcare for 25 years. Entrepreneur, owner of 3 companies. First was in-home care agency, non-medical. Second was care management and fiduciary. So that was a lot of work through the court systems.
Wow.
Now I mostly do one-on-one consulting with caregivers, and I do expert witness work through the court system, mostly related to situations of elder abuse or harm, personal injury.
I know you've had deeply personal experiences, a 25-year career in elder care, but when did you sort of realize in that journey that this is what you're meant to do?
I realized that I had an interest in helping the elderly when I was actually very young. So when I was in high school, and it was mainly because I was the youngest of 6 children, and I spent a lot of time around my grandparents and aunts and uncles, and so I really loved elderly people. But I had a social work scholarship, but I took a detour. I went and worked in corporate America and learned how to run businesses for probably almost 15, 16 years. And then through life experiences, I kind of reevaluated and said, I would really like to go back to helping people. And so I did some volunteer work with older people, and I'm like, yes, I still love this. And so I just took the leap and I started my first company.
And how does that work, Pamela? What are you expected to do?
So there's 2 aspects. So there's the court-appointed guardian and conservator, and then the expert witness is separate. So I'll talk about the guardianship and conservatorship first. Sure. I had a care management and a fiduciary agency, so I actually had employees who helped me. But in the system, somebody has to be appointed. There has to be a name on this piece of paper. And so the way that I got engaged in that was either family members would contact me directly because they would say, our parent has dementia or Alzheimer's. We as the children don't want this responsibility. We want a professional to do this because we want to remain the family members. Because when you're in these roles, you a lot of times have to make decisions that a person may not agree with. So for an older person who's living in their home, who can't take care of themselves, who has dementia, who isn't eating and can't take care of themselves, many times I would have to move them out of their home into a care community. And so for a family member to have to do that, that could be just emotionally traumatic. Where for me, because it was my job, right? And then so the expert witness work is separate, either in situations where maybe there has been a guardian appointed, either a family member or a professional, and they're not doing their job instead. So I come in and I'm asked for an opinion on standards of care, and are they following substituted judgment and the standards of the National Guardianship Association, and I give an opinion. In other situations, it could be where family members are just disagreeing over who should be appointed the guardian. And then in other situations, it's elder abuse. So maybe a care agency got hired to take care of someone, and there was an accident and this person was harmed. And they were harmed because they didn't follow standards of care. The opposite, right? In this case, the care agency did everything they were supposed to, but the family is angry because something happened, right? And so in those situations, I look and say, look, the care agency did their job. I understand the family's upset. I understand they want, some type of settlement, but really nothing else could have been done because everything was done according to protocol.
What are some of the biggest risks you've seen for older adults?
So there's kind of 2 risks when this comes up. So there's one, I always put the financial and the medical together because they go together. And so from the financial side here in the United States right now, the number of spam calls and letters that get sent to these elderly people to try to pull them into schemes, right? So elderly people get a phone call saying, hey, you didn't pay your electric bill or your heating bill, and we're turning off your electricity, and we're going to come to your house. We need a gift card for you to pay us, when it's just a scam. And so older people will fall for these phone calls or emails or letters. And I've had clients who have lost hundreds of thousands of dollars to these scams because they sound real. If you or I would get a call, and I've had a call before, these people sound like they're from the phone company or the electric company. They sound like it's real, but it's not. And so that's one financial risk. The other financial risk is, if somebody who's financially dependent on them. So let's say there was a parent and maybe a child lives 1,000 miles away, but the parent's been sending this child money every month for all these years. There can be even financial exploitation in the family. And then on the medical side, to your point, people who live alone may not notice that things are going on, right? So A lot of older adults have dementia or Alzheimer's, but it's undiagnosed, especially if they don't go to the doctor regularly, or the doctor doesn't see them regularly, or there's not memory testing done at the annual Medicare wellness visit. It's easy just to miss signs that there is a problem. And that's where a lot of times I would get appointed as the guardian or the conservator, because it would be these people who were by themselves, who had nobody else, and they were at risk. So the things that older people who are living alone can do is get your estate plan done. Make sure you have a financial power of attorney and a medical power of attorney, somebody that you trust to be able to walk you through and talk about these things.
You also mentioned that, elder abuse, which you sometimes sort of advocate for and you stand for them, it's not always visible. And what are some of the signs that you look for or that you see?
Look for issues of power and control. And this may sound funny, but in family situations, even between spouses or between parents and children, is there somebody in the relationship who's trying to control everything? Like control whether this person gets to see a doctor, or whether they should take these medications, or whether they can see other family members. So isolation is a huge factor in elder abuse, where maybe a parent's living with a child and the child's telling the siblings, well, you guys can come over, but only on Sundays, because otherwise we're busy. My first thing is, well, what are they hiding? Why not be transparent about things? Or even people in the family who have permission to share information and don't. So mom or dad has dementia. This is kind of how we're planning about this. Transparency in families is such a huge benefit to avoid these suspicions of somebody controlling another person or not giving them access to care. So it's just important, and for doctors, to recognize those type of things. It's making sure that they're talking to the person, by themselves. A lot of times caregivers will come to doctor appointments and they're needed.
Right.
Maybe the older person doesn't remember everything, right? But then that person should be spoken to separately, saying, hey, is there anything unusual going on? Just to kind of find out what's going on in the background. I always recommend that families and everybody in the family, so all the children, the parents, have these conversations as early as possible, even before care is needed, to say, okay, who's going to care for me? Where do I want the care? And put things in writing. So caregivers are so optimistic. They think, I can do this. I can move my parent in with me. I can move in with them. It's going to be okay. And then 3 months later, they're saying, oh my gosh, what was I thinking, right? This is like horrible. So you have to have honest conversations.
And you can't say you want to get out of it, because that's not very kind.
Well, but you can, because if it's harming your life, if it's harming your health and your marriage and your job and your relationships with your children, there's a point where being a caregiver, those sacrifices are harmful. And you have to say, no, we have to look at assisted living or a memory care or a nursing home or something else, because this situation, it may be good for you, but it's not good for me and my wife and my children.
So how has the social balance sort of changed in terms of what you've seen it maybe over the last couple of decades?
I think it depends by culture. So I have a caregiving support group that's worldwide. And I had a caregiver in the group who was in, and she was taking care of her grandfather who had dementia, and he was physically abusive, emotionally abusive. Fortunately for this caregiver, he passed away. But it was a horrible situation for her, and she was facing all of these cultural norms. Same thing for caregivers in Kenya and South Africa. They're like, our families just expect this.
They just expect
and
it,
what
right?
I see is, though, that these children who were in these positions are starting to say, you know what, this isn't okay, and we can't keep passing this down from generation to generation. We have to stop it, because it's not good, it's harmful.
In our previous conversation, you also mentioned that trust, right? Like trusting your caregiver, trusting your child to take care of you, or whoever is your caregiver. It's like an essential part of how caregiving works. But also misplaced trust can then open the door to exploitation.
I think you really have to understand different perspectives. And this is something that I always talk about. So caregivers get exhausted and burned out, right? Because maybe the parents are difficult, or they're seen as like not wanting to do things. But then you've got to look at the perspective of the parent who may have cancer or some other horrible disease. Just getting out of bed for them every day is like a huge thing. So you have to have conversations on both sides saying, well, mom or dad, I see this is difficult for you. Why is this difficult for you? Because until you've been on the side of being the sick person, it's really hard to be empathetic. And so, sometimes you've just got to try to understand both sides and come up with solutions that are best for everybody.
Are there payers like Medicare and Medicare Advantage supporting some of this care that seniors need?
It depends on who you ask. So,
Okay.
yes, there are more Medicaid programs out there, especially for social determinants of health and other things like that, where low-income individuals who need help with housing and groceries and transportation, the help is there. The problem is you've got to have somebody who can pick up the phone and call and ask about the programs and find about the programs and submit the documentation to qualify for the programs. I mean, the average person trying to complete a Medicaid application is like pulling their hair out because it's like, oh my God, all this documentation, right? So it's hard. The help exists, but you really need somebody to help you do it. And then from another perspective, there are states here in the United States that are looking at their own long-term care insurance programs. So like we have payroll deductions for Medicare and Social Security. So there's a pool of money when somebody does need long-term care after age 65. So there's a lot of things happening. I don't think it's perfect. You know, it's never going to be perfect, but at least people are trying to go in the right direction. They don't talk about prevention. If we can emphasize health from day one and healthier eating, exercise, all of that, we'll have less sick people who need help at the end of their lives. Because the health insurance company, I mean, it's financially incentivized, right, to treat sick people. There's no financial incentives to keep people healthy.
What are those couple of things that you think would make, like, you know, the top 3 issues that you would love to tackle?
One of the issues is that the policymakers look at it from a government issue, right? They don't look at things from like a consumer issue. So most of the research and most of the grants go from the government to government organizations, and they're silos. So there's the Department of Health and Human Services and the Center for Medicare and Medicaid and the Association for Community Living and the Attorney General and Elder Justice. All of these organizations are receiving grant monies to do the same research. There's no requirement that they collaborate, and there's no requirement that once research is done, solutions and policies come out of that research. So in my opinion, we're spending a lot of money on duplicative efforts that state problems but don't fix the problem, don't implement solutions. And so that's where policy could change if we looked at this more from a consumer perspective. And I'll give an example. So in the elder justice world, family members may need to go for guardianship, and they may be involved in the adult protective services area, right? But if there's a family member, and it could be a good family member, right? They're perceived by adult protective services and the justice system as somebody who's doing a bad thing, right? Now, in the United States, criminals are presumed innocent until they're proven guilty. But in the elder justice system, it's not like that. These people are accused of doing bad things, and some of them can't afford attorneys to represent themselves. So bad things unintentionally happen to these elderly people who have good family members. And nobody looks at it from the perspective of the family members need more help. They need to know how to do guardianship petitions. They need APS actually to help them, right? Versus work against them. So I help people one-on-one. I also have, there's 3 programs on my website that are absolutely free. One is how to care for aging parents with chronic issues, but the other 2 relate to power of attorney and guardianship. And what is this? How do you get guardianship of a parent? What are your responsibilities in these roles? And I talk to families a lot about working with adult protective services because they're afraid. They're like, well, I'm going to get in trouble. And my whole thing is, if you have a good adult protective services caseworker who will work with you, ask them to help you do the guardianship petition.
And there are people who proactively approach adult protective services for their own family.
Your mom or dad has Alzheimer's or dementia. They're living in their house. They're not eating. They refuse care. And you're the power of attorney.
You can't take them in.
You can't do anything, right? So you contact Adult Protective Services in a perfect world and say, hey, you know what? I'm reporting self-neglect by my parent. I need your help to get guardianship because I can't afford an attorney. This would be a situation where, gosh, the government would actually help the consumer. Such a huge opportunity to stop all of this self-neglect with elders, but yet it doesn't always happen because of a lack of trust.